Good morning, everyone. Lindsay Sheppard has written a book. It's called Diversity and Exclusion, Confronting the Campus Free Speech Crisis. She talks about it in a video, the genesis of the book, and the video is here too. It's about a 10-minute video. I think it's really interesting to watch what she has to say about it and her creative process. I think that talking about how she was going to write a book about free speech, but she had to tell the Laurier story first. And she was going to just tell it in an intro, but that intro turned into what she's talking about here. So I'm very interested to read it. I think that there's going to be a lot of interesting tidbits that come out with it. Regarding it, they shopped it at publishers in Canada, and there was no takers. So it's self-published on Amazon, and I think that I think that that's the way to go in the modern world, right? Like you retain full creative custody, creative rights, or intellectual property rights, and all of that. I think that's great, and it's you get to write the book you wanted to write, right? Like you get to, and she says that too. She talks about how had she signed a book deal that she potentially would not have been able to name names in the same way that she was able to do that in the version of her book that is released now. So yeah, I'm really excited to read it, and good for her for writing it. I don't think these things are easy to do, especially because it takes so long. I've been telling you before, it takes so long to address something, even if it's wrong, right? Like even if what happened is terribly wrong, and what happened to Lindsay Sheppard was terribly wrong. They shouldn't have done that to her. It made her stronger, right? It changed the course of her life forever, but they shouldn't have done it to her. But addressing that takes years, and the fallout from that happening is still falling out, right? Like it's impacted the world. And so that's an interesting place to be too. So it's interesting to see her perspective on it. And so I'm excited to read that. I've ordered the book, but I don't know if it's on the way yet. Okay. Colin DeMello says, it's one thing to use a news conference to echo your budget. It's another thing entirely to pick a journalist to ask you a question when that journalist has run for the Conservative Party in the past, Ontario politics. So this is the PC's Doug Ford. While we always welcome a diversity of voices and media outlets being involved in news conferences, today demonstrates an abuse of that process by the Premier's office. Interesting. So they're planting friendly people to ask, oh, hey, Jim, great to see you again today. What's that question you got for me? That question that definitely I did not tell you to ask me in any way and do not know what you're going to ask me? Thanks for that question, Jim. And here's the patter response, right? Like the stump speech response. And it seems like this is not a first rodeo for the Ford administration. I have long said, Canada Land is reporting, the columnist who covers Doug Ford for the Toronto Sun lives with Doug Ford's press secretary. Wow. I understand what Brian Lilley's game is now. I've said before, and I've talked about Jason Kenney. There's something odd with Jason Kenney, and I don't know what his game is, but he's got a game. I said exactly the same thing about Brian Lilley. And the game has become apparent. Sometimes love matters more than what? Than the needs of your reader? I'm not sure. But okay, to quantify what I mean by what is Brian Lilley's game, there was a time when I followed Brian Lilley on Twitter, and I tagged and agreed with a lot of his stories. I tagged them for my show, and I would highlight a lot of his reporting because I agreed with a lot of what he was doing. I agreed with the stance and the questions that he asked, and I thought he was holding people to account pretty well. And then it got to the point where, let's say, out of 5 articles, I agreed with 3 of them, and 2 of them seemed to be out of line with what his readers expected, right? And out of line with the voice that he was presenting in the other 3 articles. So I would look at those, and then I started tagging those for my show to show you what I meant about what's Brian Lilley's game. I don't understand it. And then it went to the point where it was a full-throated endorsement and almost parroting of the government line. Like, vaccines are good for people. You should get your vaccines. When everybody's vaccinated, that's when we can get back to normal. Things like that, right? And I thought, man, like the tone of this is, if the articles I agreed with are X, and the articles that are an order of magnitude outside of what I would expect if reading X, like the other stories, the X stories, then that ratio is flipped, right? Like they're all Y, right? If that's X, then the other one's Y, so they're all Y. And yeah, now I understand. Now I understand the game. Now I understand why, right? And it's up to the employer and whatever to decide if there's something wrong with that. You can tell when somebody's speaking somebody else's words, right? You can tell when somebody's drumming the party line instead of speaking what they mean, right? It would be like me saying, I got my AstraZeneca shot yesterday and I can't wait for my next one 4 months from now, which seems like a great idea. Like, thanks for the check, Miss Freeland. No, not going to happen, right? Like, and so, right? Or, saying Health Canada's done a good job. They haven't done a good job. We're a year in and they're saying now, oh no, we have to close down again. Please don't look at Florida. Really, we'll get there. So yeah, so I understand the game, but it might not be appropriate for the person who lives. But maybe the boss was like, what's great? We've got the live-in boyfriend of the press secretary to the premier who works for us. So that's great. You're hired, sir. And guess what your beat is? Just shh. And the thing is, Brian Lilley made us think about this years ago. And they cover that in the Canada Land thing. But it's interesting. It's interesting knowing what the game is. It's interesting seeing that, yeah, something's up. Something was up. Anyway, moving forward. Carbon taxes. The carbon tax ruling is judicial activism at its worst. Yeah, I don't know how you can do anything about this. Dan McTeague was asked, what's the recourse? You can't appeal a Supreme Court of Canada ruling. Dan McTeague, gas price wizard, he's a former MP, or an MPP, former MP, 93-11. And he says, shaming is important, as is a complaint to the Canadian Judicial Council. But here's another concern. The same Chief Justice is also Governor General for now. This decision should have been postponed. Wearing both hats while making a major political statement in a ruling is odd. Yeah, good point, Dan. I think that it is interesting to watch the seemingly neutering of the provinces enthusiastically cheered on by the Supreme Court under the guise of we're here to help, right? Like we're here from the government and we're here to help, right? The most terrifying words you can hear, says Ronald Reagan. And that just doesn't cut it, right? Because like sometimes constitutional freedoms are at base should be upheld over top of your intention of helping, over top of your political belief that all of the consensus on science is right? Like I think it's folly. I think that it's a poor example for a Supreme Court to set, and with all of the conflict of interest. And this is just one conflict of interest. There are others that I've seen in the last couple of days. There was a, I don't know if I can go find it. Okay, I'm not going to comment on it, but there's certainly more very serious conflict of interest, and I probably should have tagged the story. But it was 2 days ago, and there were issues with the website that I fixed this morning. But regardless, anyway, moving forward, it's very concerning precedent to set with the consideration with the rest of the context of the facts around it, including the Governor General wearing two hats. Yeah, very concerning. Moving into a lawyer for WE's CFO has written to committee to state that providing a list of the schools that were actually built and where, quote, would require months of work. This should be a no-brainer. So where were the schools that you built for people who sent you millions of dollars in funding to build schools in Kenya? Where are they? Can we check on Google Maps and see them? Oh, that would take months. Okay, get started. How many months exactly? Could you put a number to those months? Could that be in a legal statement signed and, by you and your client? Very interesting. This stuff is, it seems to be a slow motion explosion that a year later, and there's no, like I said, there's no legal consequences here, but, and the Wee brothers own $40 million of Toronto real estate. So financially they're insulated, but their credibility is wrecked. They're not going to walk into a Philadelphia, evening fundraiser and have everyone shake their hands and go, "Oh my goodness, it's nice to see you." And that's terrible for them, right? Like that's like socially terrible. They're like, "Oh my goodness, our whole life is over," right? Not remembering that they've got millions of dollars, et cetera, et cetera. All of that aside, it's very interesting that a year later, we've got questions like, where are those schools? And you were going to administer, and that would require months of work, and you were going to administer $500 million of Canadian taxpayer dollars, but you can't tell us where the schools that you built are when you administer millions of dollars on behalf of good faith donations? Man, Man, what a tangled web. So credibility is destroyed, right? Slowly exploding shrapnel that is impacting the Wee brothers. And if that's all they suffer, if they suffer just having their reputation destroyed, I think they've got away pretty light, to be honest. And lucky them, right? Because there should be probably like looking into for fraud. When you say you're doing something and then you're doing something else, that's not cool, right? And when you take millions of dollars from people and you say you're building a school, and then you take down their plaque and then take millions more from other people and then put their plaque on the school, there's a legal like check and balance for that. It's not like speeding, but I guess it's kind of like speeding, right? So they didn't get caught in the act, so they're not going to be. Nothing's going to happen in Canada. Nothing's going to happen in Canada. Okay, moving forward. This is interesting. Strong opiate substance circulating. Please read and share this message. There have been 14 overdoses in the past 2 weeks, including one suspected overdose death. 14 overdoses and one suspected overdose death. That's a huge amount of health impact, right? And I'm glad it's not 14 deaths, but there's a big impact on the community that's being ignored by our healthcare officials, not being addressed appropriately anyway. They're expanding in Guelph. They're expanding the safe injection site to include the place where the I think it's where they're housing the people who are accessing the safe injection site. Because I heard people, I've heard from private people in Guelph that we were funding, we being taxpayers, were funding taxi rides between the safe injection site and the hotels. And I was like, that seems like it's expensive. Like, anyway, COVID deaths, 20 to 49-year-olds in Canada from the full cycle, 311. Overdose deaths, January to September, majority in 20 to 49-year-olds, 4,395. Context matters. Total harm minimization matters. Total harm, not just COVID harm, right? So it seems like there's, and this is the point I was trying to make poorly with this. I mean, this is showing the single-mindedness and exclusionary mindedness of our public health in our policy decisions currently. COVID outclasses everything, right? It doesn't matter if everything is actually killing people, right? And it looks like, and this is a doctor. He's anesthesia, health information, immigrant father of 3, blah, 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 blah. So he's got his sources cited here. But it seems like we've got a lot more deaths from overdoses than we do of COVID. And it seems like nobody cares about that. Or it seems like that is not part of the conversation of what's driving those overdoses. Are those overdoses collateral damage of the bad policy decisions, right? Why didn't we see those overdoses last year or the year before? Why are these new overdoses happening? Could this have some correlation with the lockdown? Why aren't we having these conversations? If we're having these conversations, where are they? I'd love to see them, right? And it seems like nobody wants to answer simple questions. Nobody wants to answer simple questions like, what data are you using to mask our children continually? They don't want to answer that question. What data are you using for the isolation of children? Which child protection services did you consult before creating this social isolation policy, which is classified as abuse according to the Ontario Association for Children's Aid Societies? Who did you consult? Who said that was a good idea? Who signed off on that? Because I'd love to see their name, and I'd love to ask them why. Waiting for the Freedom of Information Act to be returned on that information from the Wellington Dufferin Public Health. If they didn't consult anybody, how could they possibly come up with a valid policy that takes into account the relevant legislation, the child protection legislation? Did you know that in Canada, as a young offender, you cannot be in solitary isolation for more than 8 hours in a day? Oh, just use common sense, except if you don't do this, you're going to get fined. Okay, this happens everywhere, says Trish Wood. Journalists go on the hair on fire healthcare workers for inflammatory stories and never ask for data or evidence. Story turns out to be false. The fear-based info campaign is run by us, by forces we can no longer trust. And this is BBC. So this is an overview of, on January 1st, there was a BBC broadcast talking about how there were going to be younger patients and children admitted over the Christmas season. It was, quote, "It was minimally affecting children in the first wave. We now have a whole ward of children here." And they said, this doesn't seem right. Let's look into this. And it turned out that was a lie. They didn't have a ward full of children. There was never a ward full of children. They were just worried that could happen and blah, blah, blah. And so this happens everywhere, right? This happens everywhere. This is Travis. This is Travis, and he's the Queen's Park Bureau Chief for Global News. Sorry, Travis, I get everyone's last name comically terribly wrong, and it's unintentional. I'm just really bad at reading last names. But Travis is saying, is the pandemic over and no one told me? It was just sent this, seen at Trinity Bellwood Park right now. And in the comments, you can find this was some gathering for a specific good. There was some specific, hold on, I'll see if I can find it. Here it is. Samantha Yemen, PhD, says, if this is from today, pretty sure it was a community barbecue to show solidarity with people being unjustly evicted from the Bellwoods encampments. PPE and distancing were encouraged by organizers. Outside, mostly mass gatherings are lower risk than many things currently permitted. Also, if we really care about the public health, I'd bet evicting our neighbors from their homes and encampment sites would force them into situations where they'd be at a way greater risk of COVID exposure, among other things, than this outdoor gathering. So I think it's a double-edged sword, because she's saying they were being evicted from an encampment. So the Toronto has removed a homeless encampment, I guess, and they're being evicted from that place. So they would be outside like that anyway, except they're not congregating in their encampment. They're just congregating in the park, which is where they were being evicted from. So, you can see the encampment. There you go. Very interesting. So people are using anything, literally anything, to justify. Oh my goodness, you people are the reason this thing is carrying on, and this is as hilarious and ridiculous as it was last year. The outdoor patio with the full tented indoor patio, but you can't have indoor dining. That's indoor. This is clearly outdoor. See? Outdoor patio. Can't have that. Can't have going inside. That is just, do you know how dangerous that is these days? This is, okay. I asked my public health for whatever data they've got, and I've asked in multiple ways for months, literally months, asking for what data they have around masking, what studies they use. We're going to look at a study. We're going to look at the original studies they used to justify masking and how some of them have been repealed or taken down from the Lancet, et cetera. But I've asked my public health, to justify or tell me what they're using data-wise to justify these lockdowns, and have they seen the correlations between the seasonal curves, and have they looked at California versus Florida versus Texas versus all of the data that we've got, Sweden, that talks about how places are open and no catastrophe has ensued. And they refuse to give me the time of day. I think I'm going to go away. But I'm not trying to do anything that's outside of the rules. I'll show you. During the methods here, it says the methods include, and starting and end with, a focused evidence review and gray literature review. The focused evidence review is a rapid review of peer-reviewed literature, was conducted to synthesize research evidence about the effectiveness of lockdowns and related measures on COVID-19 transmission and related outcomes. An electronic database search in Medline on November 13th, 2020 was conducted. A separate search for preprint articles was also conducted on November 16th, 2020. Search terms included, but were not limited to, lockdowns, shutdown, circuit breaker restrictions, COVID-19 ban, closure. The full search strategy is available upon request. Hand searching for relevant articles was also conducted. So, pause. I work within the limitations that are set out within the rules and guidelines that bind public health, within the rules and guidelines that bind and the foundation of their structure. So I'm not saying you're lying. Like, I'm not walking around with a picket line saying you're lying, I hate you, I hate what you're doing, blah, blah, blah. My number one priority is public health. I want healthy people to be out and living as full lives as possible, which should be public health's priority. So I address it by working within their guidelines and asking pointed questions. And what I mean by that is it says the full string the full search strategy is available upon request. So I request things like that. But you know what I find? They don't want to provide it. I say, hey, another example is on the Wellington Dufferin Guelph website. If you go to their policy page, I'll bring it up because I want to reference it. If you go to the policy page, it says policies are available upon request. Do you know how many times I've requested those policies? More than 3. I've had to file a Freedom of Information request, and I still don't have those policies. Hold on. Okay, here's the Wellington Dufferin Public Health, right? And if you go to the About section, you have to go to the bottom of the page, go to About. It's in the footer, okay? And in the About section, you get all of these terms on the side. And I went to Policy and Procedures. Here we are, Policy and Procedures, right? And it says Policies and Procedures available upon request. So when I ask for that, and then I get, which policies would you like? And then I say, could you give me an index of the policies? And they say, there's a lot of policies. And I say, I understand there's a lot of policies. That's why I want a list of policies, because I can't possibly understand, like I couldn't possibly ask for just a policy that I don't know exists. How could I possibly ask for your policies specifically when I don't have any access to them? And so there's the rub, right? So their excuse is, oh, we've got so many policies that we can't possibly satisfy your request. I'm interested. The full search strategy is available upon request. Okay. So they looked on the internet with some specific search terms for peer-reviewed and preprint articles that lockdowns worked. And then they did a gray literature review based on expert input. We conducted a rapid scan of restricted community-based public health lockdown measures, documentation from selected countries and jurisdictions relevant to Ontario. These were obtained through online searches conducted on November 17th of recent policies, articles, government websites, official press, and reports from the United Kingdom and Europe, as well as Australia and Israel. In the UK, Wales, England, and Northern Ireland were examined. In Europe, the scan focused on Spain, Belgium, Italy, and France. These jurisdictions were selected due to relevance in terms of health system context, as well as having experienced pandemic control after the first wave, followed by a resurgence requiring community-based public health measures. We described each jurisdiction in terms of brief context, lockdown measures, lockdown duration, and impact on epidemiology when available, case direction, number of cases before and after the lockdown. Due to time constraints, we were not able to complete a systemic search. However, the purpose of the scan was not to provide an exhaustive list of community-based public health measures, nor all outcomes. The focus was to document lockdown measures from relevant jurisdictions to inform decision-making for the Ontario context. They never once looked at collateral damage. They just looked at lockdowns and how they worked and if they stopped the outbreak. And I don't even know how they qualified it. How they say that if lockdown X did this Y outcome, then it was successful. I don't know what the Y outcome they were looking for is. I don't know the context, right? We did a bunch of internet searches. It's cool. And the internet searches, they took from November 10th to November 20th, 2020. And that's it. And we can lock down. Because you know why? The overview says, lockdowns were effective. This is the key points, the overview. The very first words of this document that is by Public Health Ontario. This isn't my Public Health. This is Public Health Ontario. Very first words of this document are, lockdowns were effective and proved essential in decreasing the burden of coronavirus disease 2019, COVID-19, and the first wave of the pandemic. Yeah. Yep. Available upon request, right? So I try and ask questions within the context of the framework that they are supposed to operate within. Are they operating within a proper framework right now? This has nothing to do with health and safety. This is unbelievable what's happening. We'll do some internet research. I wonder who they got to do the internet research. Like a first year assistant. Just compile things on the internet that say lockdown, COVID, whatever. Just compile that and send it to the boss. He wants it. I don't know why. Yep. Ryan Turnbull, and he is an MP, Liberal Member of Parliament for Whitby. He says, in all caps, "This is no joke. With over 500,000 COVID-19 vaccine doses in freezers, Ford continues to blame the federal government. At the same time, variants are rising and ICUs are overwhelmed as the Premier loosens restrictions against public health advice. Hair on fire, screaming and yelling, not based in data." Ryan O'Connor says, "Gold curtain Liberal backbencher wants more Whitby small businesses closed because, there's no need to fearmonger." And it's very interesting when politicians are saying, the pandemic is so scary, we have to close everything. Because, again, explain Sweden and Florida, please. Explain Texas, please. We'll look at the Texas line in just a minute. This is a walk through memory lane of the mask mandates and how mask mandates came to be, what sources they used. Balaclava goes through it. He says, just a reminder that mask mandates were implemented all over the Western world largely because of these two studies brought forward as emerging science. The hairdresser story, 2 stylists had coronavirus but wore masks. 139 clients didn't get sick. Okay, the symptomatic hairstylist served 139 clients. No one got sick. If you read a little deeper, it's acknowledged that only 67 people were tested, 104 were interviewed, and that most were wearing useless, loose-fitting cloth masks, including the hairstylists. 2% of the 104 interviewed did not wear a mask for the entire appointment. 2% of, that's it. 7 reported having respiratory virus symptoms in the past 90 days. 9 did not answer the question. 1 didn't know. Hardly compelling evidence. The Jerry P. Howard Masks for All policy paper. If only 80% of people wore cloth masks, we'd end the spread of COVID-19. Do you remember that? Last summer in Guelph, we had masks mandated in July. I think it was July 12th. They mandated the masks, and people were saying, "Oh, if only we wear masks for 2 weeks, it'll flatten the curve." And I was walking around thinking, we'll get rid of it totally. And then that line was picked up in like September in the States. Like, if you just wear masks for 2 weeks, we'll get rid of this whole thing. And no, we've been wearing masks for almost a year, and it hasn't done anything other than increase rates of illness and give people impetigo and all sorts of crap on their face, right? Anyway, this is where that came from. If only 80% of people wear cloth masks, we'd end the spread of COVID-19. I don't know how Pan News justified publishing this debunked garbage in January 2021, but it should be written or withdrawn immediately. Government MSN still cites this as justification for mask mandates. Here's the whole story, so you can see the list there, and it goes through the rest of this. It goes through the rest of mask mandates and does a good job at debunking. Here is Tracy, and she says there's MD and PhD in her bio. I don't know if that's true. Oh yeah, sports doctor, epidemiology, PhD, blah blah blah. So says her Twitter bio, but it's Twitter, so be wary, right? Fascinating correlative data out of the school response dashboard for elementary schools. Infections among masked kids are less than unmasked kids. Opposite for staff, distancing and class densities, no major difference. So here's the dashboard. You can check for yourself. The masks required kids, 30. So in high transmission communities, masks required have 30 cases, and the staff case rate is 47. No masks required, 25, and staff case rate 89. Very interesting, right? Very interesting. So the masks, I don't know if they're, and these two, so no masks require has 9 in the substantial community transmission, and then masks require had 6. So there's and then in low moderate community transmission, masks required had 3, and no masks had 7. So just to give a full, because the tweet was not misleading. I think that this is interesting to note, but it's interesting. Here's high transmission area, 6 feet, and no distancing is exactly the same pretty much. And 3 feet is a little better, I guess. And that's with the high transmission and ventilation improvements. Again, there's no increased ventilation, has a little bit higher cases, but I mean, is it statistically meaningful when it's 31 cases versus 36? And how much do these numbers really count? Are these all asymptomatic positives? Like, I'd love the context around all this, right? There's so much missing data when you look at this kind of stuff that it is hard to draw a realistic conclusion. Here's another one. Demand your districts look at this data. This is clear as day. This is Florida versus Florida mask comparison, 3/25/21, so March 25th. Today's the 28th. Here are the current cases by 100,000 by county based on red, masks required in classrooms; green, masks not required while children are seating in classrooms; yellow, mask requirements vary by grade and or individual school. So green and yellow is while the kids are seated in class, they don't have to wear masks. Red is they have to wear masks in classrooms, and you can see the data. right? It's very clear. This is American data. Florida, where mask mandates are coming down. Jacksonville, I'll show you in just a sec. But it seems like mandatory masking has a correlation with higher rates of infection. Here's Mayor Curry opts to end Jacksonville mask mandate out in Florida. So there you go. Since June, he's kept it in place. He's ending it on April 4th. So there you go. Here's Texas. In case anyone was wondering why you stopped hearing about Texas 2 weeks after the restrictions were 100% lifted, there you go. The Texas curve after the restrictions are lifted. There's no bounce back. I haven't heard anything about Florida going off the charts either. The Roy Green Show, moving into vaccines. Today, Saturday, so that's yesterday, the lead author and prominent oncologist of a UK study which found delaying a second dose of COVID vaccine for more than 21 days may be putting lives at risk. So listen to that. That's very interesting. There's concerns. There's valid concerns. I thought this was interesting too. Vaccine deliveries continue to see hiccups with Moderna shipment delayed and no news on Johnson & Johnson. 1.5 million doses of AstraZeneca vaccine arriving from US on Tuesday. So they celebrate the deals to get these things in place. And then when delivery goes sideways, they're like, oh, well, we'll just not mention that, so... Very interesting. We've been talking about how insurance companies are not covering COVID-19 vaccine injuries. And this person in the UK, I believe he's a UK guy, said, I promise to post the proof of the medical health insurance company BUPA that they're refusing to cover adverse reactions from a, quote, experimental treatment. It's taken them more than a month to get the wording right. Yeah, you don't want to send the wrong wording out on this letter, right? It says, Dear blank, thanks for speaking to me. This is UK, I think, because, Salford, UK. Anyway, thank you for speaking to me. I confirm that the side effects from the COVID-19 vaccine are not covered under our exclusion for complications from excluded or restricted conditions, treatment, and experimental treatment exclusion. If you're injured while doing COVID-19 swab yourself, cover would be available towards the injury. I hope this information is helpful. If there's anything we can help you with, please call our team on the above number. This is in line with dealing with this within the framework that exists. Asking simple questions like this of your insurance, and then bringing that to the public health and saying, the insurance company says this is an experimental treatment. Why does it say that when you're telling me that it's not an experimental treatment? And it's not like we haven't had experience with the public health not being truthful, right? Or saying something is not being sent out when in fact it is being sent out, as was the case with the March 16 letter from my public health, right? The credibility is shot. I mean, I don't know how anybody could believe. Why would you believe a liar, right? Like, if they're not lying, where's the good explanation for the confusion, for the communication sent to me and then the communication sent to the children? Which one is correct? Which one is correct is that the order was sent out and they lied to me. So why? Biden administration officials are anticipating the supply of coronavirus vaccine to outstrip U.S. demand by mid-May, if not sooner, and are grappling with what to do with a looming surplus when vaccine scarcity turns to glut. So I've been talking about how they've been advertising around Toronto that there's lots of vaccine appointments available. Make an appointment. There's no lines. Come in ASAP. And I think that indicates that maybe the demand isn't there. Like the demand outside of the places and the people who are really buying into this COVID thing, maybe it's just not there. And what happens when we've committed to buying, millions of these doses, hundreds of millions of these doses? That's taxpayer money gone already. It's been spent and agreed upon, right? So what happens when these things are going to pile up and expire and then get thrown out, right? It's happening in the US. Why does anybody think it's going to be different here? Are they going to mandate it here? Maybe, but I think that there's maybe precedent in our legal system that says they can't do that. So I wonder what their end run will be removing your access to places, right? We'll be allowing places like Costco and like, Walmart. There are smaller places that are not allowing people to enter their facilities without masks, despite mask exemptions being written into the law. Like, I don't know how they can do this and get away with it with impunity. So I will be following up with any that I come across because dealing with this with the framework that works, like with the framework they have to work within, makes everybody get uncomfortable because they realize how untenable this really is. They can't just do this. We actually have legal precedent. And until they actually do away with all that, and they might, I'm certainly not saying that it's protected and it's never going to go away. Like, when's the last time you went on a vacation to your property in the United States, right? Just jump across the border for a camping trip in the States. Yeah, right. Go to Niagara Falls, US for some Seneca casino play, right? Not happening, right? So it's just, they've taken your freedoms already, right? It's just a matter of finishing the job now. Canadian property bubble near systemic failure, and not even a big crash can fix it. This is an article going through the math of a big crash in real estate and how long it takes to save the average person making a pretty decent amount for a down payment at the prices that the property is at currently. And once you start saving, the property increases in price. They're saying it'll take 11 years. It would take 31 years to save for a down payment today. And they go through it. So first let's start with down payments. Greater Vancouver at February's prices, the GVA would require 307 months of saving, that's 31 years, to save the minimum. If you plan to flee to the Fraser Valley, you're looking at 128 months of savings, 11 years. For those not from Vancouver, Fraser Valley is the adjacent real estate board to the GVA. It's basically a suburb of a suburb. So in Greater Toronto area, it seems affordable by contrast, but really isn't. The typical down payment requires 135 months of savings, 11 years for the minimum. Fleeing to Hamilton cuts it down to 105 months of savings. That's 9 years for the minimum. You're going to have to stop crying because we've got a lot of numbers to go through. Right. So, and I don't want to get into the baseball statistics of it, but that is a bleak look. That prices every entry-level person out of the market. Unless you've got money or collateral to maybe a secured line of credit or something to that effect, some way to access money, you're not buying a house. Sorry about your luck. Not for a while, anyway, right? So that's very, very scary. That's very problematic because you need, in order for society to do well, you need for people to feel secure in that society and for them to be able to afford to live, right? And if you can't afford to live, then, well, usually the birth rate goes down, right? Goodness. I've done in-depth interviews. I've done in-depth looks at the birth rate in probably 2018. If you just look at my YouTube channel and look at birth rate, you'll see a bunch of videos, and you can have a look at what's been happening to Canada's birth rate. And it's not even getting started at this point. Like, we're watch out. Scary, scary, scary. And there are other implications, not just birth rate, right? Like, there are real implications that come into this. So be concerned, right? Be aware anyway. China says it has imposed sanctions moving into China against MP Michael Chong over what it calls rumors and disinformation in response to sanctions levied by Canada on groups in China's Xinjiang region. So very interesting situation happening there with regards to China. Michael Chong responds. He says, today's sanctions on MPs by China are attempting to silence free speech and debate in the heart of our democracy parliament. We won't be silenced. We will continue to speak up about China's violations of international law in Hong Kong and in the Uyghur genocide. So they're trying to silence They're trying to silence people from any criticism. And Michael Chong is responding to Mark Garneau. Mark Garneau says, the government of Canada stands with parliamentarians targeted by unacceptable sanctions from China. We will continue to work with partners in defense of human rights, democracy, and freedom of speech. Statement. I mean, I'm glad that they're saying these things. Sometimes the actions need to speak louder than words, though. And where's the full-throated demands to get our freedom back? Like, where's the full-throated demands to get our democracy back, right? Like, it's great that we're trying to hold China to account and all that, but what about our government that's completely abusing and taking advantage of a situation? And there are countless examples that our opposition MPs could be using to hold our government to account, and they're not. So, I mean, it's nice to read these words, but where's the opposition? Like, where are the people who are actually supposed to be fighting for us, right? Where did they go? That's concerning. Here is Justin Trudeau. He says, China's sanctions are an attack on transparency and freedom of expression, values at the heart of our democracy. We stand with parliamentarians against these unacceptable actions, and we will continue to defend human rights around the world with our international partners. But we won't tell the provinces to end the lockdowns and let businesses open up. Because, we'll get those loans to you soon. Sure. China yesterday locked in tariffs on Australian wine of 215% for the next 5 years, effectively wiping out 35% of the Australian wine export market, worth about $4 billion. Australia is taking China to the WTO for trade breaches. It's not going to go well. I mean, it's one of those things where China is exerting its political and buying power to punish countries that are trying to punish China. So, I mean, and I'm not saying that the Canadian government shouldn't have sanctioned China. I'm saying that they should have been aware that China was going to respond like this, right? And like, is anybody gaming this stuff out? Like, is anybody playing the game for the prime minister? If you do this, then this happens, or this happens, or this happens, and then like you gotta game out some situations here and there. I'm sure that there are people who do that, but it seems like we're constantly caught flat-footed without an idea of really what to do. It seems like we're always a deer caught in headlights. Like, oh no, they've realized that we're here. It doesn't look like, I mean, but it never looks like our government really knows what they're doing, right? Like, there's never a situation where I've been like, oh yeah, they're on top of that. It's always 3 steps behind and trying to play catch up. And this is a teachable moment for all of us. Sir, you're the one who groped the reporter, though. How is this a teachable moment for all of us? Okay, Pierre Polyev says, Carleton Liberal Twitter account now taken down altogether days after false racism slur and attack on Fort McMurray energy workers. Were Liberals suspended for misinformation? Trudeau and defeated Liberals Rogers have some splaining to do. So they took down that account. I kind of idly wondered about that yesterday, and before I had a chance to check, Mr. Polyev had already done my work for me, and he tweeted it out for me kindly. So I'm not surprised that they took that down. Will they apologize? And it's funny because Doug Ford apologized. And if you make a mistake, apologize. I try and if I make mistakes, I try and apologize. If I tell you something that I find out is not true, I try and update you. Apology is not admitting weakness or I mean, I guess it's admitting fault. But usually in Canada, the apology is, I'll try and do better type deal. So will these Liberals apologize? I don't know. We'll see. I'm not expecting it. Don't hold your breath. Suez Canal, no timeline given for extracting the wedged ship from the Suez Canal. My family and I were talking about this. I said, we don't get toilet paper from the Suez Canal. Don't worry. And but they were talking about how they were digging it out and the tides weren't doing it. So now that they're going to have to maybe unload it with helicopters, and there's 20,000 containers on it, to unload it with helicopters is going to take all this time and blah, 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 blah. And I think this whole thing is very interesting to see a situation that you would think that they would have planned for this. You would think that they would have a contingency plan for this. You would think that there were apparently 2 harbor masters, so 2 captains, or not 2 captains, but 2 people who should know this harbor on the ship, and this happened anyway. And with the big penis and butt thing, apparently while you're waiting to go in the canal, it's pretty common to just do circles with the ship. So I didn't know that. So maybe the captain was just bored. Who knows, right? Maybe he was just yeah, whatever. We'll have some fun. Who knows? I certainly don't know. But this whole situation doesn't seem very good, and it doesn't seem to be it seems like on one side of things, there are people who are idly speculating that this could be bad for the global economy and shipping lines and all this other stuff, and it could put undue pressure on those shipping lines and stuff. And those seem to be kind of minimized. Those voices seem to be kind of minimized, and they're giving a lot of time to delays and the logistics of getting the thing out. So not that nobody's panicking, but I don't know that anybody understands oil prices and all of the further implications, the broader implications of this, because there will be broader implications, price increases and other impacts. Just shipping goods, things are backed up, right? So there's lots of very, very interesting and not necessarily good impacts to this that we haven't even started to see yet. It's like the beginning of the pandemic, right? The first month, other than the lockdown, things didn't look all that different, right? Now a year on, it's that was a catalyst to a really terrible situation that is an ongoing terrible situation. So I hope, man, who knows what's going to happen here. How long could it possibly take to unload these containers? Maybe you start now, let's start unloading, and maybe you reach a magic number of light enough diggings happened and it moves, right? Everybody's working together. No, you know what? Let's just stand around and look at it for another week. We'll keep trying what we've been trying that hasn't been working. Yeah, because that seems to be what we're doing. Okay, last story for this morning. 100 inmates to stage hunger strike at Lindsay jail over inhumane conditions. I thought the conditions were pretty inhumane. Inmates are frustrated about a lack of drinkable tap water, dirty clothing, declining food quality, a lack of programming, no access to family members, no ability to get books or copies of the criminal code, a lack of healthy options at the canteen, a lack of good quality hygiene products, limited access to television, and bad quality air, according to Schofield. That's the lawyer. So again, be wary, that's the representative. Religious diets, including kosher and halal, are not being accommodated, she added. The quality of food has declined since the pandemic, she said. One inmate says the conditions are harsh compared to those at other prisons. Some cells are damaged with broken mirrors, sinks, and toilets. There are many lockdowns, and some inmates would rather plead guilty to a crime if it means being transferred to a federal prison, which is considered more appealing. The prison also locks down inmates at 6:30 p.m., whereas some other prisons lock down at 8 p.m. or later. Some people who have not been convicted yet but are being held there feel they're being treated unfairly. So yeah, I mean, very, very interesting situation. It's when a society treats its prisoners poorly, that looks poorly on society. And I think there's a balance that can be set because sometimes you do things that you need to go to prison for. But I think that there can be a balance set between being humane and and having justice served. And we're not hitting that. We haven't been hitting that consistently well in Canada for a very long time. And that's unfortunate because we could do better. We can do better. There are better models out there. There are better ways for our justice systems to function. Hey, I just think if we had our justice system function as written, it would work better than the weirdly and quasi-interpreted way that it's being done now. And my examples are releasing sex offenders on COVID rules and keeping pastors in prison for refusing to turn away their flock and citing the Charter of Rights and Freedoms. That's what I mean. Like, if we just followed the basic guidelines of our government, things would be much better. But we're not doing that because that's racist or something. I'm not sure. Whatever the liberals say, those are the new rules, right? They've got their magic government pen, right? Goodness me. Okay, thanks for watching, everybody. Check out CanadaPoly.com. Check out CanadaReport.co. Check out SpeakingMoistly.co. And have a wonderful, wonderful